Good morning. We've got a quorum already, so may I now call the meeting to order. I want to remind members of the following. A member who is the chairman or deputy chairman of a government advisory body in respect of matters which a panel considers to be directly related to the terms of reference of the panel shall not be the chairman or deputy chairman of the panel, and a member shall not be chairman or deputy chairman of more than one panel at the same time. Now, if a member who is absent is being nominated, then according to 22F of the House Rules, the member making the nomination must be certain that the member being nominated will accept the nomination. All right. 2013-14 session election of chairman under 77(6). That has been read out already. All right, so nominations, please. Mr. KK Fong, I nominate Mr. Chung Kwok Chu. Any seconders? 3, 4. Right, any other nominations? You want to make a nomination? I want to nominate Ms. Chen Yun Han. Then is it that someone to chair the meeting? You have Mr. Chung Kwok Chu. Do you accept the nomination? No. So you have to ask me, right? I nominate you. And you are still the chairman. All right, I accept the nomination. All right, so you can now chair the meeting. Any other nominations, please? Any other nominations? No? Then Ms. Chen Yun Han is elected chairman of the WS panel. Thank you. Thank you very much. So it's now the time to elect a deputy chairman. All right, so we'll now elect a deputy chairman. We must have a nomination and then a seconder. KK Kwok, I nominate Chung Kwok Chu. Do we have seconders? 4 seconders, including KK Fong, Fernando Zhang, and Alan Leung. Do you accept the nomination? Yes. Any other nominations, please? No? Then I announce that Mr. Chung Kwok Chu has been elected Deputy Chairman of the WS panel.
咁另外呢就
And the second Monday of each month, 10:45, the Secretary has prepared a schedule of meetings for us. Any comments? All right, so this schedule of meeting is endorsed. So date of next meeting, 11th of November, 10:45.
政府建議11份喺討論有3項嘅，第一個就對
The administration has proposed 3 items. The annual adjustment with regard to CSSA and the SSA schemes, and then setting up of rehabilitation and elderly service facilities and the development of urban renewal authority at Hai Tan Street, Kway Lin Street, Pei Ho Street, Sham Shui Po, and then setting up a new contract residential care home for the elderly and a day center for the elderly, at Tuen Mun Thang lot 499. Right. Any comments, and do you have other items to propose? KK Kwok. Yes, Chairman. Concerning drug testing, the ACAN has proposed the drug testing scheme, and this should be discussed by the security panel. But I believe members, including you, the chairman, will recall that in the last session we discussed drug testing, and the social workers said that the system was seriously flawed. And so I think maybe this item is not totally relevant to the work of the panel. Still, we want to discuss the support service for young people, and let's invite social workers, Ching Sheng College, and other relevant parties to come to the meeting. Right, members. I think on the surface, this is a security panel matter. But then concerning drug addiction treatment, that comes under our panel. Mr. Leung Chi Cheung. Now, by October this year, the living allowance, wage living allowance, will have been implemented for a year. And so I think we should discuss whether there should be a review, including whether there should still be asset testing. Ms. Helena Wong. Yes, I think we should discuss item 15 as soon as possible, social welfare planning. I think we need to have planning indicators for services for the elderly, services for children, and also I think we should also discuss the issue of domestic violence, and also child minding or child care service at the district level. We want to know the provision of child care service in the different districts, both quantity and quality, and also occasional child care service and after-school child care service. And also we should also discuss support for the carers. Right, concerning social welfare planning, in the last session, they raised the issue at the beginning of the session. And in fact, in the last session, they said that they would come to us on the matter at the beginning of the session. So let's remind them of this matter. Mr. Fernando Zhang. Chairman, the administration has promised to come back to us on the review of the disability allowance. We want to know the progress, and I think we must find some time to discuss the matter within this quarter. And then second, the UN Committee on the Rights of the Child has convened hearings and has studied the performance of the mainland, Hong Kong and Macau in this area. The UN has already completed its observation report. And in the report, the Hong Kong SAR government is asked to formulate a comprehensive policy for children. The UN's report is always discussed in the Constitutional Affairs panel, but then this observation report covers many aspects, and I think when it comes to welfare services for the children, this topic should be discussed by this panel.
Another issue is also urgent, and that is range assistance under the CSSA. A lot of street sleeping cases have got to do with this. The range assistance rates are already severely out of step with the market rates, so we need to discuss the matter as early as possible so as to help the low-income earners, in particular the singletons. All right. Yes, I think that would lengthen our queue, our waiting list. I think we need to consider which one should be given priority at the next meeting. Mr. Tankapiu, I want to pick up the point made by Fernando Jiang, that is rent assistance. Well, in fact, for our November meeting, it is about the annual adjustment of the standard payment rates under the CSSA and the SSA schemes. Can we not have it included under that item? That is the rent assistance. Otherwise, they would only present the information about standard payment rates. Of course, we can always ask questions, but we won't have anything in writing. So I think it has been confirmed that 40% of the CSSA recipients living in private housing do not get sufficient assistance to cover the rental. And then another point is, as far as retirement protection is concerned, I want to know where does it stand as far as the subcommittee on protection of retirement. I think it ranks the 9th in the table, right? But we've been waiting for a long time. A third point is about the traffic accident victims assistance scheme. Yes, it may appear to be something for the transport panel. However, we have been told that for the traffic accident victims assistance scheme, it is not timely enough and the rates are not adequate. Of course, it's something for the Transport and Housing Bureau, and it has been proposed that it should be extended to maritime traffic accidents as well. I don't know whether this is the right forum to raise the issue. And lastly, I want to talk about elderly services. I have received information from organizations that unless you are moderately impaired, according to the centralized assessment, you don't get the service, you don't get the vouchers for home care. However, there are more and more cases in which the centralized allocation assessment system doesn't sort of take care of, say, for example, dementia. So I hope that there will be standardized assessment mechanism to deal with such cases as well. Thank you. Mr. Frederick Fung, if I may include social enterprises as well, because it is another way to help the disadvantaged. So that those who are employable will get a job. And then residential homes for the elders and residential homes for the disabled. The two of us were saying that perhaps we should ask the HAP to talk about social enterprises, or the subcommittee on poverty alleviation should talk about that as well. Fernando Jiang, I think for the refugee claimants as well as the torture claimants, I think they have difficulties with making a living. I think the cases have been referred to the ISS, but then I think the problem is getting worse. It is urgent, and I hope that you may want to call a special meeting to deal with such matters. All right, you have already proposed a number of issues, but Mr. Chen Kwok-Chu would also like to raise an item. Lump sum payment. Madam Chair, I hope the SWD will come back to give an account. I don't think it has been resolved, so we need a progress report. And then Dr. K.K. Kwok referred to the drug testing scheme. But I don't think drug testing should be led by us. So I would suggest that we have a special meeting to talk about drug addiction treatment. Let's be given an account of the status quo and ask the security panel colleagues to join us so that we can also hold a public hearing as well. I hope it can be done before end of November. This is because the consultation document will be the subject matter of consultation for 3 months. We need to hand over the venue by 10:40, so the last to speak, Dr. K.K. Kwok. I agree with Mr. Cheung. This is because this is most important. If you can't convince the public that after drug tests, there would be sufficient manpower to follow up on the cases, then the public won't buy in the idea. Well, some of the proposals may have to be dealt with in the form of joint panel meetings. So the Secretary has suggested that perhaps we should include all the proposals in the waiting list. And for the next meeting, we're supposed to have 3 items. For items B and C, I think they just want to give us a briefing. But probably members would like to ask a lot of questions. So I will start on the basis of a 2-hour meeting. For items B and C, if you try to sort of shorten the discussion, then we can squeeze in a 4th one. The administration has already promised to come back to us on social welfare planning, and then the other one is about the old age living allowance. So if we want to add a 4th one, it means that there will be 4 items in total, and then the timetable may be a bit tight. But then, as I have said, for items B and C, we're supposed to get a briefing only, but experience tells us that usually we start a long debate. So can we include old age living allowance or something else? And then for the drug testing scheme, it is a hot issue. Just now, Dr. Kwok has raised this point. The Deputy Chair has said that perhaps we should rather look at other perspectives than drug testing. But as things stand, I don't think we can have it at the next meeting. But of course, I know that it is time sensitive. Perhaps we can have a special meeting. So, first of all, for the next meeting, 3 items only, or can we add a 4th one? But I don't think we can finish in 2 hours, unless we agree to shorten the time available for the 2nd and the 3rd items, and then have a special meeting for the drug testing scheme. Mr. Daniel Chung, for drug addiction treatment, I think you need to talk to the SP so that we try to see if there is a joint panel meeting. Don't have it on its own. I think it's something for the security panel, but then social workers may also want to discuss the matter. Yes, perhaps a joint panel meeting. So talk to them. Don't discuss it on our own. All right, we'll talk to the departments and we will join the SP. Now that takes me to a second question. Next regular meeting. A 4th item? No. Then for the old age living allowance as well as the social welfare planning, if they're not to be discussed at the next meeting, then have them included on the waiting list. Fernando Zhang, be quick. You cited so many topics, and yet none of mine has been included. Sure, if we are to include everything, it will be very interesting. I don't think we will ever get down to them. I suggest that we include all of them, but first of all, we'll see which one is urgent and we'll have it dealt with at the next meeting. Now, if you want to keep the proposed 3 items, then we just move on. Fernando, I think you're right. Everybody has suggested something. But then it is time sensitive. We have the observation report from the UN about the child's rights. And then for the disability allowance, again, the administration has promised to come back. And we understand that there is a timetable for their working group. We need to tie in with the timetable.
And then the refugees, this is definitely an urgent matter. The administration has promised that there will be a new mechanism in place before the end of the year. And I understand that vetting mechanism will be discussed by the security panel. But then concerning their well-being, their welfare, I think this matter needs to be discussed by us. So please make the necessary arrangements, Chairman. And also rent allowance under CSSA. Now, I think we can include the rent allowance under our first item, annual adjustment of standard payment of CSSA and SSA. Now, I want to respond to Mr. Fernando Cheung's remarks. Yes, I understand that we need to discuss the UN report on the children. Now, that report, I understand, will be discussed by the CA panel. And then concerning the refugees, last time they in fact didn't give us a reply. They immediately said that the ISS would be providing the service. But what the government should have done something and should be doing something. All right. Now, I don't think we can add anything more to the agenda for the next meeting. Mr. Tam Yu-chung, I just wish to emphasize that the CA panel has been discussing the UN report on children's rights, and every time we have a discussion, we invite representatives from the Health and Welfare Bureau to attend. So I think we have all along acted very cautiously. We do not want to encroach upon the terms of reference of or the work of other panels. Thank you, Chairman. Mr. Leung Kwok Hong, I think Australia a waste of time continuously discussing these matters. Now, concerning the OALA and also universal retirement protection, we've made numerous suggestions, but to no avail. I think, Chairman, if there are many items waiting to be discussed, then hold more meetings. It is not that we can only have one meeting per month. If we are so concerned about these matters, why can't we have more meetings? Why is it that some members are against the idea of having more meetings or having longer meetings? Now, I think our only solution is to hold more meetings. But then I think this is the only option. But of course, I don't know whether government will be willing to send officials to attend those meetings. Yes, I agree with Mr. Tam Yu-chung. Let's ask the administration when they are ready to discuss these items with us. For example, social welfare planning, in the last session, they said they would be ready by the first meeting of the panel, but they haven't proposed this item for our discussion. And then concerning the UN report on children's rights, now let's still have the CA panel discussing the matter, and then we'll see whether there are issues that we need to discuss. Now, Now, I just want to say that we all sit on many panels and bills committees, and so maybe for drug testing we can have a special meeting. But can we have another special meeting to discuss the refugee issue? Just want to say that there will be many meetings for us. So let's ask them to give us a progress report on the refugee issue first. All right, I and the Deputy Chairman will have a meeting with the administration to prioritize all these issues and items. All right, next meeting, the 3 items proposed by the administration, and then rent allowance as well. And then we're going to have a special meeting on drug post-drug testing rehabilitation service. All right. Thank you very much. Thank you. And then the subcommittee on long-term care. This is a joint subcommittee of the HS panel and the welfare panel. Now, this subcommittee will start work in December, the Secretariat will invite members of the 2 panels to sign in to join the subcommittee. And then the subcommittee will, at its first meeting, decide whether they need to elect a chairman and a deputy chairman again. All right? So, thank you very much. Yes, KK Fong. But then we do have some subcommittees under this panel. Will they continue their work? We only have this one. There is one subcommittee on retirement protection, but then it's still in the queue. All right. Thank you very much. Thank you. Thank you very much.